We're back with Colin Craig, continuing our deep dive into Canadian healthcare with a big question. Should private options be considered as part of our future? So, the debate between private versus public healthcare, it seems like some individuals and groups are more open to the idea. Should we be open to this? Does it strengthen or weaken our system further?
Uh, yes, and I think there's actually sort of two parts to when it comes to private healthcare in Canada. The first question is, should the government pay private providers to deliver care to patients?
Hmm.
And the answer to that should be yes. The government should partner with anyone who can provide quality health care in a timely manner at a reasonable price to patients. They shouldn't be concerned about whether it's a private facility or government facility or nonprofit, whatever. Shouldn't
Hmm.
matter. The top priority should be, can this particular partner provide that quality treatment in a timely manner and affordable price? So the answer to that should be yes. The second question around private, I think, is should people have the right to pay for private health care outside of the public system if they don't want to use the public system? And
Hmm.
again, the answer to that should be yes, because when people decide to pay privately for healthcare, that means they're taking pressure off the public system. That's one less patient in a waiting list in the government system.
Right.
And so, what we do in Canada is we basically say, you can pay privately, but you can't pay in your own province. So, you have to get into a car and drive to another province or drive
Oh,
to across the border to the US or
crazy.
fly to another country. It doesn't make any sense at all. No other developed country on the planet does this.
Now,
So,
before I get on to the next question, I know that you have covered the topic of how healthcare could be improved by $21 billion with no tax dollars required. Tell
yeah.
me how that's possible.
So the simple version of that research says that we could grow our healthcare sector in this country very large by a large amount to over $20 billion a year, just simply by allowing
Crazy.
people to buy private health insurance, like you could buy insurance for
Mm.
dental benefits and so forth. But the government won't allow it. So by
Wow.
not allowing it, the government is restricting the supply of healthcare. And we all know what happens when you
Yeah.
restrict the supply of something, you end up with waiting lists.
Yeah.
So
Exactly.
no other country does this, and this is
So,
why all these other countries have passed us by when it comes to healthcare,
so,
especially
so
over in
what is
Europe.
the fear of privatization based on then? Is this a legitimate threat to our current system or a potential way out of our current bottleneck?
Well, what we foresaw, just to be clear, is we would keep the public system,
Hmm.
so
Okay.
patients would still have that option, but they'd have these other options. And the threat historically has been that whenever you talk about health reform, special interest groups who do not want change, they
Hmm.
want this monopolistic approach, which we all can see isn't working. It's not working in Canada. People are suffering and dying. So these groups that, for whatever reason, they want to keep it as a monopoly, they fearmonger and they say, well, any
Hmm.
type of change, it's you're Americanizing or whatever.
Hmm.
But the polls show that Canadians are, one, they're ready for health reform, and two, they're ready for the types of reforms that give patients more choice. So
Okay.
what we need is the political class to catch up and really start to move forward with more reforms that could be quite good for patients.
So, what would we need to do then to protect the best of our current system while introducing a new solution like this? Can it be done?
It can be done. It's not that hard. You need political willpower. You need some changes legislatively in Ottawa.
Hmm.
You need some changes legislatively in different provinces too. So I think the big note is for politicians to just be reminded that the public is on side with reform. If you move forward with these and you talk with Canadians and you're open and honest with the public, you can bring in these reforms and make sure that patients end up with shorter wait times, more choices. The end result could be very good for patients because
So,
we
what
can
are
see.
some of those potential benefits that a mixed model offers that we need to consider?
So, one is more choice, right? When you go to other countries, they can differ in terms of how they provide health services. You can get different features if you want them. So there's more choice, there's more accountability. Right
Hmm.
now, if you've got a lineup of customers out the door in a monopolistic model that's 200 people deep, you don't think of customers the same as if you
No,
know
you
those people
don't.
go
Yeah.
somewhere else. then it's like, oh, well, I better provide better service, better make sure I call them back today rather than taking 2 weeks to call them back, whatever. I mean, there's all kinds of service level benefits for patients if there's more competition and patients have more choice. So those would be a couple of the benefits.
All right, so stay with us after the break. We'll look at solutions that aren't being considered yet. We'll explore what innovation could bring to the healthcare conversation. Stay with us.